And a new mama, by the way. Congratulations.
Thank you. A new mama who's actually got to go pump, so I'll make this quick. So thank you, Madam Chairwoman, and thank you to my wonderful colleagues for letting me jump the line, and to our witnesses for being here. This is really important as we're grappling with all the new technology and all the opportunities, but also some of the challenges along with it. So we know that healthcare and AI have incredible opportunities and potential. We're seeing it speed up drug development, cutting down on paperwork, and giving the doctors and patients more time, which is really the upside, the good side that has been talked about at length here today. I really do appreciate a lot of the commentary on data privacy as well. So when we're talking about these potentials, we need to also examine the downsides, which few have been highlighted here today. We all agree that AI should never replace a doctor's judgment, and it shouldn't become another way for bureaucrats, or swamp creatures as I call them, or big corporations to pull strings. Patients deserve to know that their data is safe, their privacy is respected, and that their care is being guided by people, not just algorithms. So in my district, the University of Florida, AKA the Everything School, we are testing some of the most exciting applications of AI, from digital twins of ICU units to patient-level models that help predict the most effective treatments and outcomes in tough cases like cancer. We're showing what's possible. So I want to highlight that, but also talk to you guys about some data privacy issues that we're wrestling with. So I'm going to start with you, Dr. Ibrahim. As I mentioned, my district, University of Florida, Gator Nation. I keep having to say that, lots of national titles, 5 in the country. Just putting that out there for my fellow SEC friends here on the committee. Researchers are using digital twins to not just replicate hospital units like the ICU and operating rooms, but also to model individual patient trajectories in complex cases like cancer or intensive care. How close are we to seeing this type of patient-level digital twin technology guiding real-time treatment decisions nationwide? And beyond direct care, what role do you see digital twins playing in education and training, particularly for providers in smaller or rural hospitals who don't have access to some of this cutting-edge technology?
Thank you so much for the question, and I'll keep my Big Ten thoughts to myself. The importance of this technology in rural communities is incredibly important. And in our own program, we've done discounted rates to help ensure that rural hospitals can participate. About 25% of our hospitals are in rural communities. And they're after partnering with large communities, or large hospitals, so they can have some coordination of care and triaging and sharing of expertise. Your question about our ability to identify better treatment plans for patients is super important. One of the things we've spent a lot of time on is finding diagnoses that potentially could have been caught sooner or weren't identified initially. One example was hypertrophic cardiomyopathy, where we've looked back in old EKGs and rerun our models and found that for many patients, we could have diagnosed years earlier. So I think in the current state, we have the ability to diagnose things faster. I think the future state you described, that we could actually tailor a unique novel treatment, I think that's in its infancy. It's certainly in the pipeline and horizon, but I think today we can point to that we are able to diagnose people faster. How well we can tailor the treatment is still nascent, but coming very quickly.
How soon do you expect the digital twin technology utilizing someone's medical history, their chart, their DNA, biometrics, how soon do you see that being regular and commonplace?
I think for common conditions, because the hitch of these models is having enough patients to train on. So for common conditions, I think that's very plausible within the next year or two, and there's probably some pilots that already exist. For more rare conditions, nuanced, novel cancers and things, I think we're more than a couple of years away.
Okay, I appreciate that, thank you. I'm gonna go to you, Mr. Toy. As we talked about, UF is pioneering immune system digital twins to personalize treatment and developing synthetic data that allows AI to train without risking patient privacy. From your perspective, can synthetic data and patient-level digital twins serve as a foundation for fair coding and care management across payers? And also, what safeguards are needed to ensure that they don't become tools that privatize patient data or constrain physician judgment?
Yes, absolutely. So a very interesting question. So number one, doing the second part first, I think there's a lot of privacy implications around digital twin technology. There's a lot of upside, but literally, if you are making a digital twin of yourself, you probably want to know how that's going to be used.
It's a little scary.
Right, so it can be a little scary. So I think the answer is we haven't solved all of that yet, but there are technologies that will help with this. So I think that what's probably going to end up happening is you're not making a full twin, as in it's literally my thing moving around and being used. That's going to have too many privacy implications, but it's going to be sort of like a collective model of people who are kind of like me that can then be analyzed and processed. So I have fewer privacy concerns.
Okay, and I know my time has expired, but I'll submit for the record some questions about de-anonymization of data and some of the honest broker questions that surround that. But thank you all so much for your time, and thank you to my colleagues again for your understanding. Thank you.